When working on addiction treatment, one of the most important questions is how do we determine what level of care someone actually needs? That's where the ASAM criteria comes in. The ASAM dimensions provide a structured clinical framework for assessing individuals across multiple areas of functioning, not just substance use, but medical, psychological, and social factors. This approach moves beyond the one size fits all model and instead looks at the whole person. Hi, I'm Robert Shingleton. Today I'm going to break down each of the 6 ASAM dimensions and explain how they are used to guide treatment decisions. ASAM stands for the American Society of Addiction Medicine. They developed a set of criteria used across treatment settings to assess individuals with substance use disorders. The goal is to create a consistent, evidence-based way to determine the appropriate level of care. Instead of focusing only on substance use, ASAM evaluates multiple dimensions of a person's life. This creates a more accurate and individualized treatment plan. The ASAM model is made up of 6 dimensions. Each dimension represents a different area of functioning that can impact recovery. Together, these dimensions create a comprehensive picture of an individual's needs, risks, and strengths. Clinicians assess severity in each dimension to determine the appropriate level of care. Let's start with Dimension 1. It focuses on acute intoxication and withdrawal potentials. This includes whether the individual is currently under the influence, experiencing withdrawals, or at risk of developing severe symptoms. Clinicians assess the severity and potential complications such as seizures or medical instabilities. This dimension often determines whether someone needs detox or medical monitoring. In Dimension 2, looks at the biomedical conditions. This includes any physical health issues that could impact treatment, such as chronic illness, injury, or untreated medical conditions. If these issues are severe, they may require medical stabilization before or during addiction treatment. This ensures the individual is physically able to engage in recovery. Dimension 3 focuses on emotional, behavioral, and cognitive conditions. This includes mental health disorders such as depression, anxiety, PTSD, and other psychiatric conditions. It also considers behavioral patterns and emotional regulation. Co-occurring disorders are very common in addiction, so this dimension is critical for integrated treatment planning. Dimension 4 assesses readiness to change. This looks at how willing and motivated the individual is to engage in treatment. Some individuals may be fully ready, while others may be resistant or unsure. Understanding this helps clinicians match interventions to the person's stage of change rather than pushing them too quickly. While Dimension 5 evaluates relapse potential. This includes the likelihood that the individual will continue using substances or return to use. Clinicians assess cravings, coping skills, and awareness of triggers. This dimension helps determine how much structure and support a person needs to maintain sobriety. In Dimension 6 focuses on the recovery environment. This includes where the person lives, who they are surrounded by, and whether their environment supports or undermines recovery. A stable, supportive environment can strengthen recovery, while a high risk environment can increase relapse potential. This dimension often determines whether residential treatment is needed. These dimensions are not used in isolation, they work together. A person may score high in one dimension and low in another, creating a unique clinical profile. Clinicians use this combined information to determine the appropriate level of care, such as outpatient, intensive outpatient, or residential treatment and detox. This ensures treatment is tailored to the individual's needs. The key takeaway is this: addiction treatment is most effective when we treat the whole person, not just the substance use. The ASAM dimensions provide a framework to do exactly that by addressing medical, psychological, and social factors together. In conclusion, the ASAM dimensions offer a structured, evidence based approach to understanding and treating substance use disorders. By assessing multiple areas of functioning, clinicians can make more informed decisions and improve treatment outcomes. And this model emphasizes individualized care, which is essential for long term recovery. So please, if you like this content, like, subscribe, and share.